I mentioned a minute ago gluten and diabetes. There's a lot of relationship between gluten and diabetes, and that's both type 1 diabetes as well as type 2 diabetes, as well as gestational diabetes. So there's a connection with gluten into all different forms of diabetes. So I want to draw your attention to a few things that we know. Number one, we especially know this with celiac disease, but the comorbidity of type 1 diabetes with celiac disease has been attributed to genetics. In essence, the same gene pattern that contributes to gluten reactivity is the same gene pattern that increases the risk for the development of type 1 diabetes. We also know that type 1 diabetes rarely develops after diagnosed celiac disease, and here's why. When celiacs get a diagnosis and they go gluten-free, their gluten-free diet reduces their risk of further developing or going on to develop type 1 diabetes. And so, again, a gluten-free diet largely very helpful. We know that 10% of patients with type 1 diabetes develop celiac disease. So what did I say a minute ago? People that develop celiac disease and go gluten-free rarely develop type 1 diabetes, but people with type 1 diabetes, so in essence, if they got their type 1 diabetic diagnosis first, many of them, 10% of them, go on to develop celiac disease. Again, there's this association between both of these conditions, and it has to do with gluten triggers autoimmune reactions. So in celiac disease, the autoimmune reaction is in the GI tract. In type 1 diabetes, the autoimmune disease reaction is against the beta cells of the pancreas. So studies indicate a link between gluten-free diets and reduced incidence of obesity. And this is, again, obesity is one of the risk factors for type 2 diabetes, okay, as you see here. So again, gluten-free diets reducing the risk of obesity and the development of type 2 diabetes. Gluten-free diets also shown to reduce the development of type 1 diabetes. Let's pull this image up here. This is a research study here recently published. Just read a few things to you. Possible prevention of diabetes with a gluten-free diet. Again, quoting from the study, interestingly, animal studies and a human study have demonstrated that a gluten-free diet during pregnancy reduces the risk of type 1 diabetes. Some studies have linked intake of a gluten-free diet to reduced obesity and type 2 diabetes, and has suggested a role in reducing leptin and insulin resistance and increasing beta cell volume. The current knowledge indicates that gluten, among many environmental factors, may be an idiopathogenic factor for the development of type 1 diabetes and type 2 diabetes. So again, very important that you understand this, because a lot of people, the attitude around type 1 diabetes is that there's nothing that you can do about it, and that it's kind of a lot of the people that I've talked to that have type 1 diabetes actually get mad at me. And I don't know why, because they have this fatalistic attitude that because they have type 1 diabetes, there's nothing they can do within their diet, and that they have to be on insulin for the rest of their life regardless. Now, I don't disagree that insulin's an important thing for a type 1 diabetic to take. However, I will say this in my own experience, in dealing with type 1 diabetics, clinically speaking, a lot of times their need for insulin is dramatically reduced when they change their diet to a gluten-free diet. So we know that gluten plays a role and has an impact on insulin demand clinically for those that have type 1 diabetes. And I have seen one case in 21 years, now just one, so I can't speak for all type 1 diabetics, but I've seen one case of the reversal of insulin dependence in a type 1 diabetic on a gluten-free diet. So that doesn't mean that everybody can do it, but I have seen that happen. Quite a remarkable feat, in my opinion, because you don't ever read about those things in the research. So the other thing we know about diabetes is there's this connection with leaky gut. Now, one of the things we know about leaky gut is that gluten can cause leaky gut, and so that makes sense. Most of you are aware of that. But if you look at this diagram, one of the things that happens that we've researched is that bacteria produce chemical compounds and toxins. Okay, let's change the color again. So I'm going to kind of draw these little toxins. Let's just say these other things here are bacteria, right? And they're producing these little toxins, okay? And these toxins are leaking across your gut. These are gut cells here. These are gut cells, and this is a leak in between those gut cells. So we get these toxins leaking into the bloodstream. This is the blood on the other side. And these are called LPS, lipopolysaccharides. These are bacterial toxins, endotoxins, if you will, that when they leak into the bloodstream, it's been very well researched that they cause inflammation that contributes to diabetes. And that inflammation leads to production of cortisol and a dysregulation of insulin, and that those things, again, are linked to the contribution to blood sugar problems, that chronic inflammation. So again, remember, one of the risk factors for the development of diabetes is chronic inflammation, and that's what these things do. These bacterial byproducts leak across a leaky gut. The leaky gut itself can be caused by gluten. It certainly can be caused by other things beyond gluten, but gluten is one of the most common reasons this happens. And then those chemicals can create inflammation and cause dysregulation in how your body produces cortisol and insulin, which will disrupt your blood sugar. So we know there's a connection with leaky gut. Now, again, still talking about gluten here, there's another side that a lot of people say, well, I'm going to go gluten-free, and then they go to these rice and corn-based foods, these really toxic foods that really technically aren't gluten-free. And if that's news to you, you need to watch my master class, and we can put a link up for those of you who haven't had a chance to watch it. But the gluten-free food industry is ripe with rice and corn products, right? And these products are high carbohydrate, high simple carbohydrate, I should say, and they're high carb, and so they increase sugar in the blood, right? So these, even though they're labeled gluten-free, technically they're not gluten-free, but many of you are under the impression that they are. They will still elevate your blood sugar. So again, gluten-free foods are not necessarily healthier than gluten-containing counterparts as it relates to diabetes or as it relates to highly processed sugars, carbohydrates, and other things. So if you're going and this is not just corn and rice either, by the way. So many of you are probably doing like these tapioca rolls or these arrowroot starch products, cassava products. These are all high sugar. And so, look, I'm not saying you can never have a tapioca roll or cassava chip. That's not trying to take away those things from you. But if these are your staple foods, if you are chomping these down on a daily basis, you're driving your sugar up on a daily basis, right? And so a lot of people think, oh, it's because it's gluten-free, it's somehow better for me. But if you're diabetic, pre-diabetic, or have a tendency toward blood sugar problems, and you just start eating these foods, and although they're naturally gluten-free, they're high in sugar, they're not going to help your diabetes, they're going to enhance it, or they're going to increase your risk for the development of diabetes. So keep that in mind, that gluten-free foods, like these ones up here, even though corn and rice technically aren't gluten-free but are labeled gluten-free, all of these things drive up blood sugar and contribute to major problems. So you have to be careful with those packaged food items. They're not good for you, and they can really damage your health. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.